My name is Mariana Yalon from Mayo Clinic in Rochester. Along with Dr. Prabhakar Rajia, it is our pleasure to discuss the highlights of a recently published manuscript on the Infrapopliteal CTA evaluation with photon-counting detector CT compared to conventional energy integrating detector CT. The sensitivity and positive predictive values of conventional CT angiography for the evaluation of vessels below the knee is lower than above the knee, as shown below. In conventional energy integrating detectors, the conversion of X-ray to electronic signal is indirect, involving two steps, with scintillation and reflective septa, contributing to geometric dose inefficiency, and no individual photon information recorded. In the novel photon-counting detectors, the conversion is direct, involving a single step, with individual photon incidence and energy recorded, contributing to geometric dose efficiency and small pixel size. Our purpose was to compare the evaluation of the infrapopliteal vasculature between lower extremity CTA performed using energy integrating detector CT and photon counting detector CT. This was a prospective IRB approved study where patients undergoing clinically indicated conventional CTA runoff between April 2021 and March 2022 were recruited. A conventional EID CTA was followed by same-day PCD CTA with additional IV contrast up to 200 milliliter in total. Our exclusion criteria were standard contraindications for iodinated contrast administration, such as low eGFR, positive pregnancy test, history of contrast reaction, or inability to provide a written consent. In addition, patients were excluded from analysis due to mainly three reasons, such as inadequate vascular contrast opacification, incomplete acquisition or reconstruction data, or substantial metal artifacts. The following are the acquisition and processing parameters for both modalities, where we wanted to emphasize the slice thickness of 1 millimeter used for the reconstruction of both. The reader study involved two radiologists reviewing the CTA images blinded to imaging modality, reconstruction parameters, and all clinical information. This took place in two reading sessions with anonymized EID or PCD images, with each case randomly shown once per session. For the image analysis, first, the visualization of small vessels was evaluated by counting the number of fibular perforators. Next, 11 vascular segments were evaluated at the level of maximal stenosis. First, calcium block thickness was evaluated as shown on the diagram below. Next, stenosis grade was rated, followed by stenosis cause, and finally, confidence in stenosis grading. Subjective image quality such as arterial sharpness, arterial enhancement, image noise, and overall image quality were graded on a 5-point Likert scale. The examinations performed with both modalities were compared in terms of number of fibular perforators, stenosis grade, mean confidence in stenosis grade, and image quality measures. Next, mixed effect linear regression was used to assess for statistically significant differences between the groups. 52 patients underwent clinically indicated EID CTA followed by investigational PCD CT on the same day. After excluding 20 patients due to the following reasons, such as inadequate image acquisition or reconstruction parameters, lack of vascular opacification, and substantial metal artifact, the final analyzed study sample comprised 32 cases. The results for small vessel evaluation showed a higher number of fibrillar perforators were detected at PCD-CT for both readers. An example of such a case is shown on the images below, where on the left is the image acquired with PCD-CT and on the right the image acquired with EID. The results for reader confidence score showed that reader confidence in stenosis grading was significantly higher in PCD-CT for reader 1, despite a significantly lower IV contrast dose. A representative image is shown below. For image quality metrics, PCD-CT showed greater arterial sharpness despite decreased arterial enhancement. In summary, we found that photon-counting detector CTA yields multiple advantages relative to energy integrating detector CTA for the visualization of small infrapopliteal vessels and characterization of associated plaque. Thank you for your attention.